Okay, so I'm here to talk to you today about what you should expect after the same-day implant-supported teeth procedures, and then what you can do afterwards to ensure long-term success. Okay, first, let's talk about pain. So, directly after the procedure, you should expect pain. It's generally going to last between 2 and 3 days, and hopefully get better after that. The swelling is going to be similar. Swelling is going to occur for the first couple of days, and then also hopefully get better after that. If you have an increase in pain or swelling, though, between 4 and 7 days after surgery, and you just don't really feel good, there's a chance you might have a post-op infection, and you should give our office a call immediately. Bleeding. Bleeding after surgery is normal for the first day and maybe even the second day, but if you're hemorrhaging after the second day, you should give our office a call. So as far as bruising goes, we performed quite a number of implants and probably a number of extractions and grafting as well, so you should definitely expect to have a little bruising. This is generally going to show up anywhere between 2 and 3 days after surgery, and hopefully it's gone by 7 days. Hopefully it's gone by 14. Sutures. In these large same-day teeth procedures, sutures we use are generally dissolvable, which is nice because you don't have to worry about removing them. Alright, so the next thing I want to review is a strict list of NoCanDos. First on the list is rinsing. No rinsing at all for the first 24 hours. I also don't want you poking around or touching the surgical site. Don't even pull your lip back to look for the first 7 days after the implants were placed. Next, please don't put pressure on the outside of your face or apply excess pressure, especially if bone grafting was done. Any movement of that scuff could impair the way that things heal. Next, don't smoke or drink alcohol for at least the first 3 days after surgery. It would be ideal if you didn't smoke at all after surgery because you would have a much better result if you didn't. Next, don't exercise for the first 5 days or so after surgery. Exercising will increase blood pressure, and this increase in blood pressure or blood flow will increase your risk of bleeding afterwards. Instead, I would like for you to be a couch potato. Yep, sit there and do nothing. That would be great. Do not eat hot foods or hot beverages for the first 14 days after surgery, especially for the first 24 hours. Yes, you should be only using cold foods and beverages for the first 24 hours. Then, after the first 24 hours, you can start integrating some warm food and beverages to your diet. This next part is crazy important though. Do not chew anything that you cannot easily pinch through with your fingers. A lot on this later. Next, and finally, avoid spicy foods, chips, and popcorn. If I find out you ate any of these things, I'm going to say very mean things to you at your post-operative appointment. Oh, and also, avoid carbonated beverages or acidic beverages like orange juice or grapefruit juice for the first 14 days after surgery. Alright, next, let's talk a little bit about things you can do to make the healing process go as smooth as possible. So, directly after surgery, we want you to apply just gentle pressure to the area. If we put gauze in your mouth, leave it in place for the first hour. If you want, you can change it after that. Feel free to switch it out for more gauze. Remember, though, that you need to get the gauze damp. If you put dry gauze in there, it'll pull the blood clot out, and soaking wet gauze pretty much doesn't do anything for you as far as stopping the bleeding. Okay, so the next thing we can do is we can put cold compresses on the outside of your face. This is especially effective for the first 24 to 36 hours. And then do this sort of 20 minutes on, 20 minutes off. Make sure you put some sort of fabric or cloth between your skin and the ice pack because we don't want to cause any harm to your skin. Okay, next, let's talk a little bit about your medications. I want you to take all of them as directed, with the exception of one, that narcotic pain medication. If you're not in a tremendous amount of pain, you might not actually need them. You'd be surprised how effective ibuprofen and Tylenol work together. Obviously, though, if your doctor has said that you cannot take ibuprofen, then don't take it. And if you take a narcotic medication, don't add additional Tylenol, because there's a good chance the narcotic medication already has Tylenol in it, and you don't want to take too much Tylenol because it's hard on your liver. Finally, too, the narcotic pain medication can sometimes make patients nauseous, so one more reason to avoid it. Okay, as far as your oral hygiene goes, remember, you're not going to rinse at all for the first 24 hours. Then after that, you can start lightly rinsing. Use either the prescription mouth rinse we provided, or Listerine or warm salt water. Put that stuff in your mouth and bob your head from side to side, bathing the surgical site in the rinse. No vigorous rinsing, because this could dislodge the graft or the flap, and that would be a very bad idea. Okay, you can use a soft toothbrush, but be careful not to brush the gums or anywhere where grafting was performed. You could dislodge the graft material or move the flap around, and this might cause some serious damage. And then the absolute no is the water pick. Do not use this thing for at least the first 6 weeks after the procedure was done. It may disrupt the healing and cause the implants to fail. Next, let's talk a little bit about your diet. Everything needs to be cold for the first 24 hours. Then you can start doing warm after that. You can go back to hot foods by day 14. These have to be incredibly soft foods. Remember, if you can't pinch through it, you shouldn't be eating it. If you blended your food, this would be great. Don't forget this pinch rule. Honestly, if you just didn't eat for the first 3 to 6 months after we did this procedure, you'd heal perfectly. But the problem is, you might actually starve to death. So that's not an option. But you get the point here. These implants are not stable. If they move, they fail. In fact, the only reason any of this works is because they're all fused together with your new teeth. But if you apply enough pressure, you will cause your implants to fail. Okay, finally, I want to talk about some of the stuff that you can do in the long run to ensure the long-term success of your implants. So, for the first 3 to 6 months after the implants were placed, the implants will be going through a process we call osteointegration. This is where the jawbone actually fuses with the implant surface. The actual time that it takes for this process is variable. I mean that based on the type of bone, upper and lower jaw, or your overall health, and if bone grafting was placed at the same time. These are all variables. So, based on all those variables you present with at my office, we will make a prediction on when we think the whole osteointegration process will be complete for you. This will be when you come back for your final healing evaluation. If at this appointment everything looks healthy, you'll be ready to move forward with your final prosthesis. It is important that you move forward with this because the temporary teeth were not designed to last much longer than this. Beyond this 6-month period, the teeth may wear down and become weaker. So you need to make it back to your restorative dentist to get the final teeth put in. Oh wait, but you're not done yet. You have to maintain this stuff. You basically just purchased a car that you put in your mouth. And just like a car, you need routine maintenance for your implants. Not only from what you do every single day, which is brushing, flossing, and water picking, but you need to be seen by a dentist every 3 to 6 months. It's also going to be necessary to have your prosthesis removed every year or so that you can have it thoroughly cleaned. And you need to have your implants checked at this appointment as well. So, if possible, we want to catch problems before they become catastrophic failures. I think you want the same thing. Remember that just because implants can't get cavities doesn't mean they still don't get gum disease. How often you see your dentist has everything to do with your level of risk for implant complications. One of the major risk factors for implant problems is a history of periodontal disease. So if your parents or you had it previously, congratulations. Unfortunately, you are at risk for peri-implantitis. You need to be seen every 3 months. Also, if you're a former smoker, a current smoker, have a history of diabetes, or take serotonin selective reuptake inhibitors, you need to be seen every 3 months. If you can, quit smoking. It will cause implant problems or even failures if you continue to smoke. All right. Hopefully this video helps you maintain healthy implants for the rest of your life. See you soon.